Everyone, my name is Dr. Akshay Kashid. I am a consultant cardiologist at Manipal Hospital, Pune. Today we are going to talk about the myths and facts related to the cardiovascular diseases. So basically, cardiovascular diseases are a group of diseases which affects heart and blood vessels. And also it is the leading cause of death all over the world. Almost there are 18 millions of deaths which are registered worldwide. But surprisingly, almost 90% of heart related deaths are preventable if we act at the right time and if we improve the lifestyle. So what are the myths and facts? The most commonly, the myth is related to the risk factors related to the cardiovascular diseases. So what is the commonest myth? The most common myth is, I have smoked for a number of years and even if I quit now, my risk of heart diseases will not reduce. But what is the actual fact? The fact is, the benefit of quitting smoking starts the minute you quit, irrespective of how long the number of years you have smoked. So your risk of heart diseases will reduce by 50% the moment you decide that you will quit smoking, and progressively over the number of years the risk reduction is almost 70 to 90%. Now the second myth is the family history. So now my parents and family members have suffered from heart diseases and heart attacks. So there is a high chance that I cannot skip from getting the heart problems. So the actual fact is, yes, though there is a strong risk factor about the family history of getting the heart problems, but with the healthy lifestyle and modification of the lifestyle, reduction of the risk factors, there is a chance that you will live a normal and healthy lifestyle without getting cardiovascular diseases. Now the next myth is, I have suffered a heart problem, so I should not exercise, because while exercising there is a chance that I can suffer from the heart attack. No, but this is totally wrong. The actual fact is, being sedentary itself damages the heart more. So we should be physically active. Exercising at a mild to moderate intensity definitely will reduce the risk factors and it will protect your heart. So we should avoid having the sedentary lifestyle and we should involve ourselves in the aerobic exercises and we should inculcate the healthy lifestyle. Now the next myth is, wine is good for heart health or certain alcoholic beverages can prevent hypertension and heart problems. But the actual fact is, even the recent researches have shown that any form of alcohol will definitely affect adversely to your heart, and there is no alcohol or no wine, even including the red wine, which is going to protect your heart. Now the next myth is, exercising at a vigorous level just for 2 to 3 hours is sufficient for a week to protect the heart. But this is wrong. The actual fact is, we should perform moderate to vigorous exercise for 30 minutes for 5 to 6 days a week, and it will definitely avoid the heart related problems. There is no data which supports or suggests that vigorous exercises 60 to 90 minutes is going to protect the heart. The myth is, egg is bad for the health because it contains the cholesterol. But the actual fact is, the liver obtains the cholesterol from the saturated fat and trans fatty acids and not from the dietary cholesterol. Egg definitely contains the saturated fat, but at a very less quantity, just 1 gram. So additionally it contains vital nutrients such as lutein, choline and vitamins like vitamin A, vitamin B and vitamin D. So 1 or 2 eggs per day are recommended. So these are some myths and facts related to the risk factors associated with heart problems. I hope this video finds you interesting. Thank you.